Hey, Shaun, how are you?
Not too bad.
Good.
I have until like 6:45. I have a council meeting, so
Totally understand. I don't think we have much that we have to cover. I do want to get the updates that you've been working on so that it can be recorded and put in the minutes. And also, I think we worked on the focus so that when I go to the steering committee, this group is done with the focus of the work. I had a few people say they won't be able to make it this evening, but hopefully some will be able to.
yeah, we've got one task that is not in progress, and that is the consumer cooperative. But all our other tasks we've made headway on, or but I can brief on those tonight. We just had that one remaining task that we haven't even gotten to step one with yet. So
okay, and then that would be great to have in the minutes because I'm not quite sure what it means. So if that could be explained, then I can begin to hear it. I'm also going to want to share screen. I have tons of agendas up. None of those on the right one. Try that again. Hi, Leona. Is that you out there? What I want to try to do when we set up our future Zooms is not have to do well, this one went right in. I didn't need the passcode. So maybe Leona fixed that. I'll have to ask.
yeah, I never use passcode, so I just click on the link and it lets me in.
That's good. That's good.
Are you going to cover that first item? Because I'm not familiar with what that is on the agenda.
Which one?
Update on EC proposal post regional leaders meeting on 9/22.
So you have the meeting with the Upper Valley regional folks. And I just wanted you to say that out loud so it got in the minutes.
Okay, that
So a
meeting.
quick follow-up.
Yeah. Okay.
There's so many.
Yes.
That's great work that you did in regard to the regulations. That's really good news.
Yeah, the planning department put that together, so that'll cut some barriers out of the way and really streamline that process quite a bit.
Yep, and Amy is right in noting that what you started there could be used in other places too.
Yep.
So it's great to be kind of the model of something to share it out.
I got an email yesterday from the director of Health and Human Services in regards to the fingerprinting, and She just wanted me to link her up with the Chiefs of Police Association so that we can do what we're doing in Lebanon
Excellent.
throughout the state. So I'm making that connection right now to facilitate that.
Which group was that one? Recruitment?
We just talked about it at the steering committee. Yeah, I would fit into the recruitment. Yeah.
Okay.
That's really the group where that belongs.
Yeah, wherever we can celebrate, I think that we should.
Yeah.
Because there's a lot of work going on between meetings that I want to make sure we capture at the steering committee level. So that's fingerprinting. I'm hopping on to see if I'm getting consulting emails on there. I say we start, and what I'm going to be doing is push out the recording and the minutes for people who can't be there. I know there's, we're all now in the midst of work and everything else, so we might miss a few people. So I'm going to pull up the agenda so that it's actually visible when people see the recording or want to hear it. What we're going to talk about today. And for folks to know that the minutes from the previous meeting will always be at the top of the agenda. And if you could give us an update on the ECE proposal, post-regional leaders meeting on 9/22.
Yes. So
he's hopping on.
Yeah. So we met with several folks from Vermont, mostly home care providers, but some center providers. Basically, that was our phase, our second meeting with providers that we had talked about. The steering committee felt it would be appropriate that we met with the providers first to get their input before we move the concept any further. So this was the second and it sounds like the last meeting with providers, just to give them an opportunity to understand what the city is proposing in terms of a center here that would the capital cost to be absorbed by the city through grants, and then a provider would operate that facility. Presumably on city property, with the different requirements that we have talked about in the past. That meeting, I think, went pretty well. It certainly helped me because I was able to ask a few questions about some of the issues that providers were dealing with, because remember, I'm not a child care provider, so that was really helpful to get the insight from them. So I think that meeting went well, and they expressed some of the similar concerns that the folks in the first meeting expressed, that the potential for a facility of this size to poach their employees, for better pay and benefits, was a significant concern in there. But there was a different concern that maybe I didn't fully understand in the first meeting, and that was that if they're going to this facility for a preschool program or something of that nature, the in-home care providers are going to lose that child and potentially another sibling, and it doesn't value them to have them for part of the day. They need to make the money, obviously, to make it economically feasible. They need that child for the whole day. And if they're going to this facility, parents are not going to want to move from one place to the other. So that presents a problem for competition in terms of other than infants for a facility of this nature. So that was helpful to understand that a little bit better. But yeah, those are some of the basic concerns. And then one of the providers asked what, if they could participate or submit a proposal in regards to the RFI that the city's going to be putting out. And I said, absolutely. And that's why we're doing it as an RFI. We're not doing it as an RFP, because an RFP is usually open for 30 days. And when someone submits a proposal, it's like a bid, very similar to a bid. What you get is what you get, and there's really no room for negotiation. Whereas an RFI allows us, it's going to be open for 90 days, and it allows us to actually work with a prospective party that wants to participate in this, and we could help them craft their proposal. It gives us a lot more flexibility. So that's why we're doing it as an RFI. So that, again, I thought that meeting went very well. I learned some things from it, and we got some decent feedback from that.
Great. I think in talking about the RFI, we did push it out through the listserv here. And I see Amy, did the RFI information get pushed out to the people the directors that you work with as well?
We didn't do it. I wanted to make sure that it wasn't a draft. I didn't know if we were supposed to be doing comments in like a draft form before they see it. So I was holding off till I had a chance to ask that question.
So what you were pushing out was just the ability for them to pre-register, because they have to register in our program, so that they won't be able to see the RFI. I sent you a subsequent email for the two of you in particular, and a couple of others, to actually have the ability to comment on the draft.
Right.
So that's not it. The only people who have that link are you folks to do that. And I got quite a few comments from Brooke, which is really helpful, and some of my own staff as well. So that the people who pre-register will not be able to see that until we decide it's ready to go and we launch it, which I gave until the end of the month. If we can do it more quickly, so be it. But I wanted to give time for our key people to be able to take a look at it, that being the two of you and a couple of others, to provide comments before we do that.
We have a network meeting next Tuesday, so I will highlight that now that I understand exactly what the system is, that they kind of just reserve a space of interest.
Right. So what happens if they do that? They'll get an email that the RFI is available, and then they can go look at it, but they have to pre-register. Yeah.
Okay.
And the blurb that went on the listserv, I think you could copy paste and send it out to the people that you see, the directors that you work with. I think it's safe to send it the same language. I just copied, pasted from Shaun's email to us and deleted a little bit of it and then sent it on the listserv. So I think that went out a couple of days ago, perhaps.
Have you
That way-
heard? Have you heard anything from Elizabeth about this?
Elizabeth Ash?
Ash, I'm just curious.
I don't even know if she's aware of it.
Okay.
I know she does read the emails that go through, because she asked if I could assist her in registering for the New Hampshire New Futures conference that went out. So I do know that she has been keeping up with the listserv things that have gone through. I haven't seen her at a meeting. The last meeting, I think one of her staff members was injured, so she couldn't attend. And as far as the, so that's the RFI information that can go out at this time. And
It's
then
important that people use the code. There's two codes that I provided. If you use that code, any RFI that I put in that code, which I've already done, that means they'll automatically get it. They're a classified vendor. And you can just be an interested party. You don't have to actually even want to submit a proposal. I want to take a look at it. You just register through that program and they can just take a look at it. But use those two codes that they are a vendor in that category, and then they'll go right to them.
I've already been on and looked. I've been looking at it, trying to think about it a little bit. And Shaun, I saw you on the news. I mean, on the commercial. I had no idea that who did that.
The state did that. They
Yeah.
paid for that. Yeah.
I thought that was good. And then finally having the governor at the end say something, but I haven't been on what's the website it brings you to? Childcare Y or?
I'm not sure. When I did this, they did the shots. There's a couple different versions. There's two different videos. One I appear in, and the other, then they have somebody else in the different ones. So that wasn't set up when they did this. This was this summer when we did the videos.
I just think it's good because it's not the same people. It had lots of different perspectives, including municipalities and parents and employers. And I like that. So we'll see if it helps.
that's great.
So the RFI, like I said, I'm just waiting for our folks on the steering committee to make their comments and then make whatever changes we need to make based upon that feedback. And then whenever we feel it's good enough, we'll put it out on the the procurement site, and then folks will be able to reply to it, and I'll just adjust the timeframes on that. And the expectation is that once that is launched, people have to ask questions through that portal. That way, everybody else gets to see those questions and the responses to those, so it's a fair process. So the expectation is there will be a lot of questions and a lot of back and forth, so that people understand how the whole process works and what we're looking for to get to that point. And my expectation is that through this RFI process, we will select probably one of those people, that is one of those entities that has submitted that, to be the ultimate provider. We're not going to do a separate RFP process for that, because they will help us craft what the ultimate provider agreement would be and what the parameters of that will be.
Can you give us an update on the ECE center regulations that the city has been working on?
So the council will actually talk about those tonight. We're presenting them to the council. And basically what it does is it streamlines the process for if you want to operate a child care facility. There are special exceptions in some zones and variances that are required in others. And we're removing those. We're asking the council to remove those provisions. So it just really speeds up the process, streamlines it, makes it easier, because it can be a dizzying process when you have to go through multiple boards and committees to get something approved. And this just really kind of streamlines that whole process. So tonight they'll discuss it, and then there'll be a public hearing in January, but there'll be community conversations that have not been scheduled yet that will occur between now and the date of that public hearing. And some of those will go before the voters, some the council will approve. And there's some decision making on the council, which ones it chooses to approve and which ones go to the voters. And some are required by ordinance to automatically go to the voters. So we'll see how that process rolls through.
So it's a pretty quick turnaround because of the vote in March.
Yeah.
To get the language and get people's input on it and make sure the warrant article is clear, that people understand what they're voting for, I think is always time consuming too. So that's good that you got that.
So
that
advocacy
rolling.
should think about whether or not, I know advocacy is not like the advocacy for a bill, whether or not it wants to weigh in on those regulations and be supportive. They can send a letter and support it if they choose to, or not. They need to think about whether or not they want to do that. ECE could do the same thing. ECEA, if you wish to do that, to be supportive of that. I don't anticipate any opposition to it, but you never know what might come out of the woodwork. And
would you draft something kind of like Moms Rising did for people to sign up rather than each organization developing their own letter, which takes time and not a lot of people have time?
That could be helpful as well if they chose to do that, and then we can present that to the council that night.
Yep, have signatures on the bottom supporting the letter. Anything, and just the more I work with everyone, the more I see everyone's pulled in so many different directions that if we make it easier for people to do it, they're more likely to do it. And if ECEA signed off on it, underneath that, you would have all the names of the people that Amy works with, which is a lot of people.
Yeah, that would be great. Because if you have somebody who's in opposition, there's nobody in support, that's can have a major weight. So that could be helpful.
Yep. Right. One of the things that we wanted to talk about today is I'm getting to the point in all of our groups that we are finalizing the focus area. We're fixing the language. We're making sure that it matches. I added the last sentence. And I'm open to ideas, but currently it reads, this group will identify and catalyze strategies to reduce operational cost, including cooperative procurement of services, tax breaks, etc., support current ECE providers and ways to bring new ECE professionals into the field. That sounds a bit more recruitment. What I was thinking about was what Shaun just did to help with the regulations to make it easier for people to open a business. So I wanted to capture it, and I just stuck a sentence in because I knew I was going to forget if I didn't put something in. What might we get rid of that and just put in including building permit requirements or something like that?
Yeah, zoning requirements.
I can put it right up here. Is there anything else that this group would focus on? We talked briefly, Amy, that Shaun has been contacted by, who was it in regard to fingerprinting?
Director of Health and Human Services.
And I think that was gonna fall under the retention and recruitment group of getting people in. Are you, since you two tend to be the folks that are consistently at this committee meeting, does that make sense as far as drafting the main goal purpose? Anything else you'd want to add that you've talked about?
So, yeah, it's Karen Hebert. She's the Director of Division of Economic and Housing Stability, Department of Health and Human Services, which deals with the child care issue. So she had asked if the offer was still open to assist with coordinating with the Chiefs of Police Association to do basically what Lebanon is doing now, to allow people to applicants for child care provider provisions to get live scan fingerprinted on a much more relaxed basis. Most places that you have to live in that city or town or have a business in that city or town. And of course, we've removed that provision only for child care providers. So what I've done is I met with my police chief, and we're coordinating a meeting with the Chiefs of Police Association to see if we can get the other chiefs that have live scan fingerprinting to do the same thing statewide. So I've been in email over the last 2 days in email contact with Karen, and we're moving forward on that, so that can help the rest of the state on that piece. And that really is Amy Brooks' area, not so much ours for facilities, but obviously I have the ability to make those connections, so I'm doing that.
Amy,
I
are
think
you doing?
I think that's like what I'm thinking is like tapping the resource of this committee to navigate these barriers. So, you know, Shaun, when I emailed you the other day, we have a brand new provider in Cornish who she got her fingerprints, thank goodness to you, and submitted her application, but or she submitted her fingerprints, but she's struggling with zoning.
Yeah.
It's Cornish.
I know.
I mean, we can't have that in one meeting. So, you know, it's a special meeting. You got to have an exemption. You got to fill out a form. You got to go before the committee.
Yep.
Like she said, they just take their jobs really, really seriously. And I'm like, that's great. But if they are actually standing in the way of, she's taking 2 infants. She can take them now because she can do X amount of kids without being licensed. The parents she's trying to get them in. Can you imagine, like, you know, I have to go to work. Like, can you get and the zoning of Cornish is holding that up.
Yep.
So I just feel like, and I know that Jenn Legear is working on this. I think it's HB 230 to give some like statewide kind of guidance as to how, so towns know they don't need a commercial kitchen. They don't need a parking area. They don't need hardwired fire alarms, and they don't need a sprinkler system. It is a family-based childcare. And I guess this is the other piece, zoning, and this is the second town I've heard about this, is trying to make them, they're trying to do what licensing does, except making it harder. And I had that experience. I had to tell my health officer to back off, because everything he was trying to make me do was 2.0 over what the state needed.
Yeah.
So, you know, they wanted this fence with this parameters and da 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 da. And I'm like, if that fence passes childcare licensing, you don't need to have a 6-foot fence with, you know, like, what did they don't want to have in-home childcare? I mean, it just seemed like they were popping up barriers. Cornish does not have any compliance, like any, they may have like parking, like you have to have enough parking or off-street parking. I can see with that being a standard thing, but I'm quite sure they don't have a childcare regulation list that says you have to have the fencing. They're making it up. They're
Yeah.
saying, but do you have a fence? Do you have a, it's like,
I know.
stay, you know, just worry about the zoning.
And that's
Commercial,
a,
residential.
that's a common problem. You have planning boards that put in regulations that aren't there in the middle of the meeting. Well, you need to have that. We don't like that bush. We want it there. And it's one of those things that people say, okay, if I give you the bush you want, even though it's not in the regulations, will you give me my permit? And people say it. Yeah, I'll just leave it at that. That it is a definitive problem. There's no question about it. So that at least we'll have a model here that others can use, and people can share this with their other communities. Man, I obviously can't tell other communities what to do, but we're streamlining our process, and if they model theirs on ours, then it should be much easier. But the problem you still have is members of planning boards and zoning boards sometimes go outside of what's written and subdivision regulations or the actual zoning regulations, and they put conditions in that were never there in the first place that they negotiate.
Arbitrary, just had
Right.
this idea. So I guess I was looking for guidance from the group as to like how we can either offer support to providers to, I mean, luckily this person is trudging forward. Other people may just say the heck with it. Or can we go to corporate counsel and say, listen, can we do some, you know, can we make a flyer from corporate counsel that says, be friendly to in-home childcare startups. Here's how you can support them or
Well,
something.
This is the season right now where towns and cities across the entire state are making changes to their zoning regulations. They're in that window right now. In fact, petition warrant articles for zoning, I think, are like November 1st or something like that to December something. There's a 30-day period. So this is the time. Again, we've got a draft and people can, there's no copyright on it. People could use that. One of the things you could do is, look, here's Lebanon has some regulations for that. And that helps streamline the process to help facilitate childcare facilities, which are in a dire need in the Upper Valley. And communities might want to consider looking at this model or versions thereof to adopt in their own communities. So the power of suggestion more than trying to force people, something to think about.
Is that a topic that comes up in your, do you have like town, is there like a town zoning group or a town fathers selectmen group that could get some information on this? And
It's the Planners Association, but they probably have a circuit rider plan. I'm sure that in Cornish, they don't have their own planner. They're too small of a community. They may use the regional planning commission or something like that. And some of them don't have anybody. But the Planners Association, they do share templates back and forth with each other. But some of these towns are really small, and I don't know what they've got for resources.
Does this have anything that falls under a meeting with Tracy, Ann, and Allison? And Ann is the Grafton resource, something for Grafton County. Does that fall under her?
Well, no, because it's called Cornish is Sullivan County.
But could they
So-
talk, or like Tracy's part of is there a group that's New Hampshire or a group that's Vermont that I could connect with to push that?
You know, at
information?
the county level is not a bad idea, because
Then
yeah,
they
let me
meet,
think
right?
about that.
It can't hurt for me to talk about it on Friday, right? And she might know where to go if it's not the right fit for her. Or if you find out something in between, just email me and I'll follow up on it about the planners.
And I guess I would put it as like how to support towns in being family-based childcare friendly.
Right.
Something like not picking on a town or a size of a town or whatever, just like how to be friendly to that. Like,
And we want to make sure we extend this to the Vermont side as well.
and family childcare, Many family childcares can give more flexible hours than center-based. You'll find that those family providers are nurses friendly, you know, drop off at 5, pick up at 8, like if you don't treat them well, we have the potential to be opening 3 in Sullivan County right now. We have, you know, that's a big deal, but we're running into issues.
So I think the best way to do it is providers that may live in the communities to go to their board of selectmen and say, look, here's a template. Would you consider this? This
Right.
would help us in our industry move forward, especially if they live in that community. I mean, Cornish is probably could care less what I've got to say. You know what I mean? When I mean, they got their own community, right? I mean, I don't live there and I don't work for them. So that's more powerful. If somebody walks in there and says, look, I'd ask you, the board, to consider, this possibility that the city of Lebanon is doing this right now, and this could help streamline that process, allow for more childcare, which our residents need. It's critically important. That may be the best way to do this at the very grassroots in each community. So Ann works for GRDC, and they're for economic development. They do grants and loans for economic development. She wouldn't be involved in the zoning side so much.
Okay.
No, but she would be connected she would be connected to the economic development piece, which makes, I'm just thinking like it's the messenger. Me being the messenger is never good, but if you pick the right messenger, like just somebody who a selectman would listen to, like Joe Kenny, or somebody that they'll say, listen, this is somebody that with an idea to make your town better. I don't have a specific issue with your town. I just want to give you the opportunity to take a look at this, something like that.
Well, let me keep working on some ideas, and if either of you think of something, I'll definitely follow up with it for sure. One of the words in the focus area, the word catalyze, I don't know if that's necessarily what this committee does. Based on the conversations I've had with the steering committee and elsewhere, it's more as if this committee supports the strategies than actually mobilizes them. I think, Shaun, because you wear both hats,
Right.
There's a lot of mobilization that's happening in Lebanon because of your roles. But I think in general for vital communities, the group would hear ideas and support strategies. And I was listening, Amy, and I pulled from your conversation to reduce barriers. So are we okay with changing catalyzing to identify and supporting strategies? So it would read like this. Identify and support.
And also developing strategies too, because we've got a component of that.
Identify.
Yeah, I think
Hello?
you good. I think
How's
identify
that?
covers it. I think yeah.
Hi, Julie. How are you?
Good. How are you?
Very well, thanks. We're just fine tuning this North Star. I go to the steering committee on Friday, and each group over the next week or two is finalizing that part of it. Shaun gave us some updates about the regional leaders meeting, the RFI that they're putting out about the early childhood education center. And we were talking a bit about making connections in regard to zoning requirements that Lebanon, Shaun's going to be talking to his council in a few minutes, bringing that forward. So if that goes well in Lebanon, how can we share that information with other municipalities, make it a little easier to support at home or centers to come in. And then this group, Amy, we never really talked about, and I didn't know if it connected or not. You did a great job, by the way, summarizing the survey information at the last meeting that we were at. So thank you. I didn't know if there were any pieces that fell from that work into the facilities and models group or not for next time. No.
Pretty much all of it.
Okay.
Is related to this. I mean, ultimately, it's to reduce costs. And then maybe find some real funds to put back into wages to support the recruiting and retention. It's kind of.
So do you want to provide the summary again, like you did last time, talking points to this group to see what actions we can take on the findings of that? Or do you want to see if Kim's available to do that? What works best for you and Kim?
So we, I think that Kim needs a little time to dig a little deeper, and then there will be some, I mean, she had recommendations,
Mhm.
but she's going back again and digging deeper.
Okay,
So they're kind of high level recommendations, and I feel like maybe we could narrow those recommendations down to some obvious actions that the group can take. There may be things that we can't.
that would be
Or-
super, because the next meeting is Wednesday, October 17th. So we have this North Star now, steering committee is going to nod. Amy, you'll give the update on the recruitment and retention meeting. Shaun, you'll give the update on this meeting at the next steering committee. And then if we could say, we are also going to be talking about the connection to Kim's survey and this committee, kind of the, for lack of a better word at this point in the evening, but the big ideas. Then maybe we could take those and go, hey, we can work on this and this and that in this group. So I think, does that sound like a good conversation for our next meeting on the 17th? And we'll find out from Shaun how you did with your city council meeting this evening and their regulations. I'd be curious to find out how many people sign up for the RFI, right? Because if it's a need, I'm just curious. It'd be good to have an update on that. Is there any other topic that you want to talk about next time?
So we just have just a couple of things, an update, and I'll have a better update even then. I sent out version 7 of the tax exemption legislation. Some more changes were made by attorneys on that. That went out to Senator Bradley, Senator Prentice, who I'm hoping, well, Senator Prentice is gonna be the prime sponsor. And then Senator Bradley just was waiting for NHMA's input on it. So hopefully he'll sign on as a sponsor, and I've got 3 state reps signing on as sponsors. The deadline has not been set for the Senate yet. It'll be sometime in November, but that's now it's in their ball field now to be able to move forward with Senator Prentice. That was sent out this morning. So there's that piece. So we had a number of objectives. One of those was the public-private partnership, which we just talked about, the RFI, which by the time the 17th, I don't know, the steering committee may be comfortable with me, sending that out, so people might be able to actually see it. And then we did the property tax exemption legislation and the zoning regulations. And then there was the consumer cooperative. That's the only thing that we have not made any headway on yet. I'm still waiting for the data to be able to complete that. But that's the only task that our committee from the original list that we just haven't made any movement on. But the rest are all in motion and pretty well developed, from where we are at this point.
And quickly, what was meant by a consumer cooperative?
So the concept was that you would have a mass of businesses that would help subsidize the cost of childcare. And that could happen in a couple different ways. It could be, for instance, we would have an arrangement with the childcare provider. We would subsidize some of the cost of that childcare. We would pay a higher amount for our particular employee, which would allow that childcare provider to pay their staff better benefits and salary. But you would need enough mass to be able to do that, enough businesses to sign on to do that, would have enough kids that if you were taking care of 6 kids, and if 3 of those were from the consumer cooperative receiving that additional subsidy from the employer of the parent to help offset some of those costs, they could pay a higher amount of money. And what we looked at was if my employee, I said my employee is not going to pay any more than 12% of childcare costs, and I was going to subsidize the rest up to a ceiling, I could budget for that and I would pay that directly to the childcare provider, not to the employee. That way, potentially you could avoid a tax impact issue. But then again, that may require some federal legislation to clarify that. So there's still a couple of unknown pieces. But in order to do that, we need to know what the true cost of care is for these individual slots, and how much of that subsidy would need to be paid to make that effective, so that a child care provider could say, I would need to get this much money. I would need to have this percentage of my children that are being sent to my facility would have to be in that subsidy program to allow me to pay my employee X amount of dollars and provide X amount of benefits. So there's quite a bit of field work that still has to be done to ferret that out and develop that concept, and to see if, in order for businesses to be able to sign on to that, we'd have to build a model.
Mhm.
And we've got quite a few missing pieces to get there to see if that's going to be viable or not.
Okay. Great. So what I have for the next meeting is Amy kind of giving us big ideas, perhaps more information on the tax legislation update that you've involved Senator Prentice. Be interested in finding out who signed up for the RFI, and then looking a little bit more into this consumer cooperative concept. I think, Amy, we've talked about at different meetings what the true cost of care is. So I think we can expand upon that at the next meeting a bit. And I haven't gotten too many businesses involved yet because I don't think the mission is clear. And once you get businesses involved, yep, go ahead.
The true cost of care, Julie, is like throwing mud on a wall. Like it varies according to their enrollment.
Mhm.
It varies according to their if they have enough staffing to be at full licensed, there's like whether they own their building, lease their building. It's just nonprofit, for profit. There's like, Julie, what would you say about the true cost of care?
A lot of variables to truly define it. And there's been work done at the national level, but yeah, it's not as simple as we want to believe it is because of all the variables. And there are some tools out there. You have to define your quality base too first.
Can I add to that as well?
Hi, Amelia.
Hi, everybody.
Sure.
Sorry, I didn't have a link for the meeting and I don't know what time. I thought you were starting at 6:30, so I'm not sure if I'm coming to the end of the meeting or I'm just on time.
We started at 6.
Oh, okay.
I messed up too. I thought it was 6:30, so apologies.
Yeah, well, anyway, I'm glad I'm here for some of it. And the other part for high quality childcare is the level of education. So you can look at it that nursing has steps for different levels of education, RNs, LPNs. The same thing is true in early ed for degrees and how much education you have at each level.
I think it's kind of like a bit of a chicken and the egg, because if you don't have that information, how do you start the conversation? How do you gather it? Do you throw some pasta against the wall or mud and go, based on this kind, there's, make 3 different groupings and say, if it's this kind of grouping, this is the average. If it's that kind of group, it's this, just some place to start. And that's why until we kind of galvanize and know what we're asking businesses for, I haven't really done the push to get more businesses involved, because we want to be clear what their role is so that they feel energized and engaged, not frustrated. And then it's kind of like starting a new math program. If the teachers don't have the supports in place, they're not going to want to do it, and it's never going to happen. So just trying to figure that out for the next meeting. Yes, Amelia?
I would also just wonder if anyone else in the country has established that. I know nationally, NACI has standards and things, but I wonder if there's any other communities that have captured that.
I can look into it. It's probably just as unique for each community. Also looking nationally too, right, Amy? It's just,
Yeah, we requested for the next, I don't know where we are in this, Julie, but we've requested in the past, they set the subsidy rates based on a market rate survey. Shaun will get a kick out of this. So we send them our rates, which are, you know, the rates that we choke our staff with in order to keep it affordable for parents. And that's what they base the fund off of. So it's obviously underfunded. So what we really want is a true cost of care market rate survey.
Right.
So, but we've got to figure out how we would help centers kind of plug that information in. So and we come up with a baseline, like, so if your lowest paid employee were $15 and, you know, if we chose to go ECE level 1, you know, level 2, level 3, if your ECE 1 qualified teachers are paid this, like across the board, how much would you need to charge to pay your bills, to pay those wages and the rest of your bills? That would be the market rate. But right now we base it off of subsidizing parents with wages.
Mhm.
Right, that obviously that model's not working. And that's why we got to figure out what that cost is. So if maybe they're charging $300 a week, I'm not sure what the numbers are, right? But it's 500. So the employee would pay a certain portion of that, but the employer would pay the rest of that to get that to that level so they can actually pay people a decent salary and operational costs and so on. And in return, they got to provide certain level of service, like you talked about. Is it level 1, 2? I don't know what those are, but yeah, I know that you have levels of service because we want something in return for that, because we're growing the next generation of future citizens and employees.
Well, what you have is we have studies that will tell us what creates high quality childcare. And that was done by Congress in 2015, Transforming the Workforce. And one of the highest indicators of quality that I learned back in graduate school in the 90s was teacher turnover rate, and that was directly related to salary. So there are a lot of little indicators that we've studied throughout the years that can let you know what high quality childcare looks like.
Yeah, and for me, I'm going to lose. I keep talking about the example of my clerk next. I'm going to lose her. She's going to be going out here in a couple of weeks, and she's on a list of 60 people are ahead of her for childcare. So she's not coming back to work. So the cost for me to train somebody else to do that, it's going to be $8,000 to $15,000. For me to turn around and say, you know what, I'd rather keep that person who's trained, understands the job. I'll pay $8,000 or $10,000 to subsidize that childcare. It makes sense all day and night, right? In terms of the cost for me. But there needs to be some structure by which that happens. So anyway, that's what we're trying to get to, but there's a lot of work with that. And the whole concept, we want to hire somebody to help develop this, but we've got to have some baseline numbers to get there.
Well, this is the work to do. And this has been the big magic bullet, right? If somebody had figured this out, this is what I tell the people in the field. I say, look, if someone had figured out how to pay you more, they would have figured it out. And the way that it's been organized by all the big thinkers is public-private partnership. And that's what you're talking about, Shaun. This is a public-private partnership. So we're doing it right here. So if those are the questions we have to ask, I'm all for it. I'm so excited. I want to be a part of that conversation because this is what we've been waiting for decades. So
But it's the private partnerships like the bank in Dartmouth and other companies, Hypertherm. It's worth, the people I'm talking to, it's worth spending that money for that. That's a worthwhile investment to do. We just need to create the model, the structural model, how it might work and get there. So that's the one task that we have not made much ground on. These other tasks, again, we've gone over them, and those are in process at different levels and getting there. And I got to jump because I have to go to the council meeting so we can get the zoning regulations changed for childcare facilities. So I got to run downstairs and get them on that. And I'll let you continue the meeting, Joanne, and
Thank
I
you.
will talk to you folks later.
Have a good
Thank
night.
you, Shaun, for doing that good work.
Have a good night.
Take care. Amelia, can you resend me your most updated email address and I will send it to Leona? And are you on other subgroups of this
Yep.
initiative? So if you wouldn't mind, please noting which different work groups you're in. I just want to make sure that you're getting the information. We're updating our work groups, so I would appreciate that. And according to the schedule I received, our next meeting is Wednesday, October 17th. And that's going to be from 1 to 2:30. And you'll notice when I send out the agendas, at the top, we'll have the Zoom link. And it will also have the minutes from the last meeting. So if people missed a meeting, they can hop in and go, this is what they talked about. We'll also be adding the recording too. So if people want to listen to it in the cars or driving into work or something like that, they're welcome to do that. Any other topics people wanted to bring up today? I'm just going to look at the chat. Going to dinner, my husband's pacing. That's awesome. Are we set for the evening? Anything else anyone else wanted to mention before we end or adjourn? All right, hearing none, I really appreciate your time. We are doing some exciting work, so looking forward to seeing what the next year brings. Thanks so much. Have a great night.
Thank
Take care.